If you want the Prophet to plead on the day of the stampede,
if you want the Prophet to plead on the day of the stampede,
love Allah and Al-Habib, salawatullahi alayhi, salawatullahi alayhi, salawatullahi alayhi.
The Prophet, peace be upon him, peace and blessings be upon him. Let us all say together, salawatullahi alayhi, and Nabi sallu alayhi, salawatullahi alayhi. Kulukum kulu sawa, salawatullahi alayhi. The Prophet, peace be upon him, peace and blessings be upon him. Let us all say together, salawatullahi alayhi. The Prophet, peace be upon him, peace and blessings be upon him. Let us all say together, salawatullahi alayhi.
Ya Taiba, Ya Taiba, Ya Dawal أيانا اشتقنا لك والحوا ندانا والحوا ندانا يا طيبة يا طيبة يا داول أيانا اشتقنا لك والحوا ندانا والحوا ندانا.
نحمده ونصلي ونسلم على رسوله الكريم أما بعد فأعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم وإن يمسسك الله بضر فلا كاشف له إلا هو وإن يمسسك بخير فهو على كل شيء قدير صدق الله العظيم. And if Allah should touch you with adversity, there is no remover of it except Him. And if He touches you with good, then He is over all things competent. That's Surah Al-An'am, chapter 6, verse 17. Assalamu alaikum to everyone attending. For those who know me, my name is Mohammad Usman Sharif, and I was presenting the show last year, and I'm back again this year with 3 shows lined up, essentially to give you guys a bit of education when it comes to health, answer any questions if you guys have. So just to introduce myself, I'm a medical student myself, with a lot of background within the medical field, and every show I'll be having a specialist doctor available, and I'm very pleased to announce that today I've got Dr. Nadia Rafiq, who's here with us today, who is a pediatric rheumatologist, consultant pediatrician with a specialization in pediatric rheumatology at the London Evelina Children's Hospital. She qualified in 2007 at UCL and now has over 10 years of experience in pediatrics. She's trained in London and is specialized at Great Ormond Street Hospital. So I'd like to say assalamu alaikum to Dr. Nadia Rafiq.
Wa alaikum assalam.
And Jazakallah for being on the show today.
My pleasure.
So we're here part of Revive FM, which is a new radio show that's starting. So to start off, I want to give the number out first. So if anyone wants to call in, it's 0333 444 0940. So that's 0333 444 0940. So essentially what you can do is call in about any medical issue that you've got, whether that's adults or children related. We'll try our best to educate and give as much advice as we can, really. I hope Ramadan is going well, and I think today's show we're going to be concentrating on a lot of pediatric issues, some common pediatric issues that arise quite commonly. Dr. Nadia Rafiq, congratulations on the birth of your baby boy recently.
Thank you.
And I think this topic would be quite useful as well for everyone. So I'd like to start off with generally a newborn, and I think one of the biggest topics that comes up is jaundice itself. So do you mind explaining a little bit about jaundice, especially in a newborn baby?
Yeah, so I just want to say Assalamu alaikum to all the listeners and Ramazan Mubarak to everybody, and I hope everybody's having a blessed month. So yeah, I've been blessed with a baby recently, and it's absolutely amazing. And hand on my heart, I can say, even as a pediatrician, this is a completely new ball game, and the whole past 2 months has been a completely new experience. I thought I was relatively okay with knowledge of children. It turns out I didn't know a lot about being a mother. So my admiration and respect to all mothers out there, and I've got an absolute new level of respect for mothers, because there's nothing else in the world that can explain or justify how amazing a job it is. So it's phenomenal. Jaundice. So jaundice is what commonly is known as yellowish coloration of the skin. That's simply what it means.
Yep.
And it's very, very common in newborn babies. And the most important thing is that in most children, so probably 90%, it's going to be a normal jaundice, which is known as physiological jaundice. So when a baby is inside the mother's uterus, so mother's womb, the baby's got a different type of hemoglobin, a different type of fetal hemoglobin. And once the child is born, that hemoglobin changes to adult form of blood, or adult hemoglobin. And that process causes a breakdown of red blood cells. And the byproduct of that is something called bilirubin, which causes jaundice. So that's the medical explanation. So it's very normal for a baby to be yellow tinged after they're born. So that normal jaundice starts after the first 24 hours of life. And on the whole, you just treat the baby as normal. As long as the baby's feeding well, is gaining weight, is still having poo which is coloured, and baby poo can be anything which earth colour, so brown, yellow, green. Any field colour is normal for a baby, and the urine is light coloured, then you probably don't need to do anything. Yeah. So, however, if the jaundice starts before 24 hours, or if the baby's poo becomes very, very pale, starts becoming clay coloured, white coloured, chalky coloured, if the urine becomes very, very dark, like brown coloured, if the baby is so sleepy that they're not waking up to feed, or if anything else that worries you, then it doesn't need to be checked out, because there's a small percentage of children that can have an abnormal type of jaundice. And on the whole, whichever type of jaundice it is, most children make a complete normal recovery. The normal type of jaundice, very rarely, some of them need something called phototherapy, so it's kind of like a sunbed treatment. So a baby wears little cute sunglasses and goes under ultraviolet rays, and that converts the jaundice, because obviously the light penetrates our skin and helps convert the jaundice, and so baby pees it out. So some babies will need that, and it's nothing to worry about. They'll go on to be completely normal babies. They might need that for a few hours, they might need it for a few days, but it's completely normal practice. And any postnatal ward in the UK, there'll be probably about 2 or 3 babies having that. So that's how common it is. Yeah, so I think jaundice is one of those things that can be worrying, but is very normal.
Yeah, I mean, a lot of new parents essentially do worry about this, but I think the main point is the fact that it is completely physiologically normal for a baby to have jaundice after 24 hours.
That's right.
Since they came into this world, and it can take up to a few weeks to go away.
That's right, which takes up to 3 months.
Yeah.
So you can still have a very mild level of jaundice, and my baby had jaundice, and I was telling the health visitor and the midwife, I'm not worried about it, I'm not worried. And they worried about it, so they made me go to the hospital and get it checked out, and I was kind of sitting there thinking, oh my God, I can't believe I'm doing this, but you have to do it because I'm a mother, I'm not the child's paediatrician. So if you're advised by a health professional to do something, you have to do it, including me. So I went there in the hospital A&E department. I phoned up my colleagues and I was like, I'm coming in, you need to do a jaundice test. And they were laughing at me because, yeah.
A lot of people actually, that brings me on to another topic, a lot of people think that doctors get preferential treatment when you go in hospitals and stuff. Actually, we're all the same, aren't we?
We are all the same. I did phone up before going in. I said, I'm coming in. So I was a little bit expedited, but I think with a newborn baby, you're always going to be expedited anyway. So any child certainly under the age of 1 month, kind of goes on top of the list of the A&E children's file because you quickly want to see the newborn. Most of the time, they're going to have a simple problem anyway, which is some things we'll talk about today. And if they don't, you want to fix it quickly because a newborn baby needs urgent attention.
Definitely, and I think it's quite important that parents do pick up on the small signs that they do get from children as to when they need to go in and not. And I think the safest thing is to go into hospital.
Absolutely. If in doubt, always, any problem, jaundice, regardless of jaundice or not, if you think it's urgent, then absolutely go to hospital. If you think your baby's unwell, if you're worried, A&E is your first port of call. If it's an absolute emergency, dial 999 and an ambulance will come out to you. For other things that you think, I think my baby's okay, but I'm not worried about this little lump or this little bruise or this little skin rash, maybe my baby's a bit jaundiced. All of those kind of things where actually a mother will know, I'm not that worried, but actually this is... So most of the time, you've got a few options. It's perfectly safe to go online and do a Google search, but look up on a decent website. So nhs.co.uk is the gold standard. Anything you read on an NHS website is written by a professional person, and I think that's what I use. I wouldn't recommend Wikipedia or anything else because you don't know who it's written by. And if that doesn't satisfy you, or you're still unsure, and if it's 9 to 5, Monday to Friday, your health visitor would be your first point of call because they're fantastic knowledge, source of knowledge. They'll tell you about baby feeding problems, baby skin problems, baby movement related problems. So that's often a very helpful resource. And most boroughs, particularly around East London, will have a daily health visitor clinic. They change in location, so they might change around different GP practices or different community centres. So when you have your baby and the health visitor comes out to you, they will normally tell you where the clinics are. So you can take your baby along, or you should most certainly have the contact number for your health visitor to call. Failing that, 111, the NHS helpline, it's a very useful resource where it's not an emergency, but you need some medical advice. They will also be able to advise you. Other than that, also your GP obviously is a useful source. But I mentioned those things, the other things first, because getting a GP appointment can be difficult. But again, a newborn baby will be prioritised, and I can't imagine any GP not seeing a newborn baby if the mother's worried. So you've got all of those resources to go to before you go to a hospital if it's not an urgent problem, and I'd recommend that because unless it's absolutely essential, I wouldn't recommend anyone go to a hospital or A&E department.
Definitely. And I think one of the biggest things that they say is the mother's gut feeling is really, really important.
Absolutely.
And as doctors, even we've been told that mother's gut feeling is, you should always act
crucial.
On it. You should always make sure that you have a safety barrier to make sure that you understand the mother's gut feeling. Because
absolutely.
Whatever a mother knows about a kid, a doctor can have a lot of experience and still not know anything about a kid.
So there's this, that's an absolute gem because mother's intuition is like the gold important piece of information any paediatrician is trained to know, that you do not send home a child if a mother says, I am worried about this child. If you do that, you'll regret it for your life, because anytime any paediatrician has done that, and there's countless journal or abstracts about it, a doctor's made a mistake, because if a mother says I am worried, there is usually something to be worried about. Obviously, if a mother's still worried after you've done everything and the baby's very, very well, then we're dealing with something different. But I'm talking about the first time you meet a parent, a family, and if a mother says something's not quite right, you need to take that seriously.
Definitely. And that actually brings us on nicely to the fact that jaundice in adults as well. And I think people underestimate that as well. And jaundice in adults essentially manifests as discoloration of your eyes, of your skin as well. And a lot of people underestimate the importance and the significance of this. Do you mind giving a bit of light on this as well, please? Yeah,
so jaundice in adults is a different ball game from jaundice in newborns. So jaundice in adults should always be assumed as an abnormal unless there's reasons. And there's some genetic causes like Crigler-Niger syndrome, where a person can have it's still, I guess, a type of physiological jaundice where you have a jaundice to a stress response. But those people will know that they've got that, and in their case, it's nothing to worry about. But if it's a generally healthy, well person that suddenly develops jaundice, that must always be investigated, because that's probably not normal unless proven otherwise. And common causes of jaundice will be blood disorders, can be infection, and can be liver problems. So there are many, many other problems, but they're probably the things that need to be looked into. A lot of the time they can be rectified, and a lot of the time there's treatments available. So the most important thing is to get it checked out as soon as, so that something can be done about it.
Definitely, and especially if an adult has jaundice, in most cases they are unsymptomatic. It's only other people who tell them that, oh, the eyes are looking a bit yellow, or the skin looking a bit different. Is that correct? Yeah,
that's correct. And with I mean, sometimes if you're very tired or you're unwell, you can look a bit pale, you can look a little bit yellowish, depending what ethnicity you are as well. So I wouldn't be worried immediately, but certainly if your sclera, which is the white parts of your eyes, if they start becoming quite yellow and it's there for more than 24 hours, then that's enough of concern to be checked out.
Yeah, that's fine. Thank you very much for that. And the other topic that comes on nicely with newborns, essentially, and the biggest one that's out there right now is colic, essentially. And it's something that all parents struggle with. Most parents struggle with. In fact, I did as well with my newborn as well. So I think that's one topic that we should talk about, and essentially what happens to a baby when a baby has colic, and how would a baby normally present. Although I know there are various symptoms a child can present with. That could be anything from not feeding to sort of cuddling himself up. So do you mind explaining on that a little bit, please?
So colic is a very interesting concept. There is no unified diagnosis or a certainty about what exactly it is. The definition of colic is an unsettled baby in an otherwise well baby with no medical problem. That is the definition of colic. So it means a crying baby, an unsettled baby, like you say, a baby that's holding their arms and legs tightly together. It's anything in a baby that can't be explained, but actually the baby, something's not right about the baby. And to a lot of people, rightly so, they need to get it checked out if it's a reoccurring thing. And your paediatrician or hospital doctor, health visitor, midwife, somebody will check the baby and say actually the baby's very well, and actually they've got colic, because that means there's nothing wrong with the baby's just unsettled. Some theories, and probably the most common accepted theory, is that maybe it's something to do with the baby's tummy. The baby might have gas trapped in the tummy. Baby might be having tummy spasms, bowel spasms. It's not defined. We don't know for certain, but that's actually probably the most commonly explained reason why. And lots of colic treatments are therefore based around tummy things. So tummy massages, gripe water, and some people make home equivalents of aniseed water or fennel seed water. So mostly those things aren't harmful or dangerous, but neither is there any medical evidence to say that they're effective. So I think it's reasonable to try those things if you want to try those things. There's no known harm, but you won't be prescribed them, similar to as you won't be prescribed any cough mixture by a doctor, because again we don't have the evidence out there for it. But if it works for you and you find it helpful and soothing, fine. The most difficult challenge of the whole thing is to reassure the parents, to say that actually your child is really unsettled. I'm really sorry, it's a horrible time for you, but your child isn't suffering overall. They're actually growing and developing, they're doing very well, and this won't be a lifelong problem. It's a short-lived problem, and mostly it grows out by the time they're feeding on solids. So probably around 6 months they'll be all right. So that's the hardest thing around it, is to reassure the parents and to reassure that the baby's actually going to be fine.
And it's the same thing like you mentioned. If you think that if the baby is completely different than what they normally are, then obviously get that checked. But if the doctors do come out and say that it is essentially colic, essentially it's one of those games where you try and see how does the baby change? Like, is it the feeding that's a problem, or something else that's a problem? And then you work upon that, don't you?
Yeah, exactly. It's important to go through all those things, like feeding. The most important, babies need to feed and grow. That's the concept of a newborn baby. That's all they're meant to do. They're supposed to feed and grow.
And sleep.
And the part, so that when they sleep they'll grow. So they'll do that. And as long as the baby's feeding and growing, you're not dealing with any major problem. Because the minute a baby doesn't feed and doesn't grow, there is a problem. So most paediatricians will be reassured, and that's why everyone's got this red book now.
Yeah, that's what I was going to mention next. That's the biggest thing, isn't it, for children?
So please bring it with you when you go to A&E or to your GP appointment or health visitor, because that's probably the most useful resource to monitor the child's growth. And as long as the child's growing on their centile, their growth chart, so there's a curvature that babies grow on, it's considered normal. I will say, however, that there can be a small drop in the growth chart, or there can actually be a small jump in the growth chart depending on how the child's doing. That's quite normal, and it's actually not a snapshot decision about how the child's growing. It's a long-term graph. So you analyse how a child's done from birth, and if a child suddenly drops, you monitor that and you watch it over the next month or two, and then you make a decision whether it's abnormal or not. So you don't panic the minute a child drops off their curve.
Yep.
That's normal. They'll just catch up the next month normally.
Yep. Okay. Jazakallah for that. I think we'll take a short break and we'll come back and talk about a very important topic that's been in the news a lot recently. One of them is vaccinations, and I'm sure you're quite passionate about this topic. And the other one I want to quickly talk about as well is rashes and allergies in children as well. Inshallah, we'll see you guys again soon after a short break. Jazakallah.
سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك तेरी मोहब्बत की महक से ये ज़मीन व आसमां आबाद है रहमत की बरसात आती है दिलो जान या रसूल अल्लाह अय्युहल मुख्तार फीना ज़ादना الحب حنينا جئتنا بالخير دينا يا ختام المرسلين يا حبيبي يا محمد يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك يا نبي سلام عليك يا رسول سلام عليك يا حبيب سلام عليك صلوات الله عليك رضيت بالله ربا وبالإسلام دينا رضيت بالله ربا
وبالإسلام دينا وبمحمد صلى الله عليه وسلم سلم نبيا ورسولا غايتي رضاك والقلب في يقين يحيا على هداك ذو الجلال في علاه ما لنا سواه هو واهب الحياة فلنبتغي رضاه القادر الحليم الغافر الرحيم إن قال كن يكن سبحانه العظيم رضيت بالله ربا وبالإسلام دينا رضيت بالله ربا وبالإسلام دينا وبمحمد صلى الله عليه وسلم سلم نبيا ورسولا حياة ديننا عطاء والكون من ضياء يستلهم الصفاء ربنا ارتضاه لنا كامل تمام قد جاء بالسلام والخير للأنام وأنا به رضيت وبنوره هديت سأظل ما حييت أقول في دعائي رضيت بالله ربا وبالإسلام دينا رضيت بالله ربا وبالإسلام دينا وبمحمد صلى الله عليه وسلم سلم نبيا ورسولا
Bismillahirrahmanirrahim. Welcome back, everyone. It's good to see good messages of support on Facebook from everyone. For especially Dr. Nadia Rafiq, a lot of people are commenting about you on the show as well, saying it's a very good show.
Oh, thank you.
So the next topic I want to talk about is childhood vaccinations. And the reason, I know we talked about it last year.
Mm-hmm.
We had a whole show about it, and obviously it's available for people to view on Ramadan FM. But the reason I bring it up again is that the Department of Health have released their statistics again over the last year, and again, sadly, there's been a decline in 9 of the 12 routine vaccinations that are given to children, especially at the ages of 12, 24 months or 5 years in England compared to all the previous years. So the meningitis B coverage, obviously that's a newly released vaccination, so it's the first time the statistics were released. It had a 92.5% uptake at 12 months. So the 5-in-1 or the 6-in-1, as they say now, if you include the other vaccination, at 12 months, that declined for the 5th year in a row. And it decreased 1.6% since 2012 and 13, and it's the lowest level it's been since 2008 and 9. And then the other one, the most controversial one, the measles, mumps and rubella vaccination, measured at 2 years, it decreased for the 4th year in a row, and it's now at 91.2%, the lowest it's been since 2011 and 12. So that clearly shows how big of a problem vaccination uptake is. So the way I want to do this, I want to start off by asking you about the benefits of vaccination and also the different types of vaccinations that we give our children, because a lot of parents don't know what vaccinations we're giving, what's it for and what the understanding behind it is. And I know that's a massive topic, so if you could summarize that essentially, what the vaccinations are, what they're covering, and why we give it.
Yeah, I think it's an absolute tragedy that there's been some misinformation, unfortunately, over the last 15 years, perhaps a bit longer, with regards to immunisation. So, of all the health policies we have out there, immunisations are probably one of the most important as a disease prevention strategy. So I can't actually enforce how important vaccination and immunisations are. They are without a doubt life-saving. Before the presence of these vaccinations, if you looked at statistics of childhood death, it was hundreds of fold higher because of these illnesses that we can now prevent. And these illnesses are so debilitating, are so horrendous, that if you were to come across a child with polio disease or tetanus disease, you'd be so frightened, there'll be absolutely no doubt in your mind that you'd want to vaccinate your child. And God forbid your child ever be, unfortunately, in a situation to encounter one of these diseases. But actually, there is now a genuine threat because of the lack of immunisation in the community, that there is a chance of these children containing these illnesses in the UK. And most predominantly, I'm talking about measles. So measles, mumps and rubella was the MMR vaccine. You asked me what infections are covered. So the first vaccine that's given to a child is the BCG, which is for TB. And then at 2 months, so at 8 weeks, 12 weeks, and then so at every second month, third month, fourth month, the child is given kind of the 6-in-1 vaccines. So this is testing my knowledge a bit as well now. So tetanus is covered, diphtheria, polio, whooping cough is covered. Now the drops are given to the child, so the rotavirus is covered as well, and meningitis B is covered as well, which is infection. So these are all different types of infections, but essentially they can affect your neurological system. And if the child is to catch any of these infections, they can be debilitated for life. They can be very unwell with the infection itself. So high temperature, rashes, generally very unwell. Sometimes it can affect their breathing. So polio can affect your breathing. They can need they can need ventilation and their lifelong problems with breathing if they survive. And neurological system is one of the worrying things, because they can develop seizures, so fits, and they can affect the child's brain is still developing. An adult brain is still developing to the age of about 20. Till you're 20 years of age, your brain is still developing, your nervous system is still developing, and it's going through a rapid growth phase, especially during the newborn period and the first year of your life. So any neurological hit or any brain damaging infection can have serious long lifetime sequelae, and these infections are horrible and they're well known to cause neurological damage, particularly measles. So I can't enforce how important it is. There's absolutely no justifiable reason not to give a child immunisation.
Yeah. And I think most of the reason why they have the vaccinations is the neurological damage that they cause. Most other problems, like such as bronchiolitis and stuff like that, although in rare cases it can cause problems, but in most cases those are things that can be treated straight away and are not contagious enough. But measles, especially that you mentioned, is now an official outbreak, especially in Europe and America, where a lot of children are now suffering from measles just because they didn't get the MMR vaccinations. Do you mind explaining a little bit about measles, just to aware the public of the signs to look out for, in case there is any?
It can be a bit difficult because a lot of children have, the first symptom is a bit of coryza, so cold flu symptoms, which are present with any viral illness. That's going to be the first thing you have with measles. So you can have streamy eyes, you can have a crying, unsettled child, a bit of temperature. The other classic thing is a rash, the measles rash, which is quite a pinky coloured dotty rash. If you Google measles rash, you'll see it everywhere. It kind of looks like freckles, but it's pink coloured freckles, and they cover the child with it. They can get reddish, pinkish eyes, and they can develop some red spots in their mouth as well. These are kind of later stages, white spots in the mouth. The most common thing is a high temperature, an unsettled child with a rash, which is everywhere around the body. Typically, it starts behind the ears, but normally by the time you see a child in a hospital setting, it's kind of spread around the whole body. Pink, freckly rash.
Yeah. That's fine. And also, the MMR vaccination is not given up until 12
1
months,
year.
1 year. So,
That's right, yeah.
So parents do need to be advised about the things to look out for. And one of the things that you mentioned, rash. And rash generally is a very, very big topic because any sort of acute rash in a child, what are the things that parents should look out for?
So the classic thing that worries people about rashes is the meningococcal rash, which is a separate disease from measles. Meningococcal disease is what causes meningitis. And so that's typical. Everyone's taught this glass test. If you roll a glass across the skin, most rashes fade away, including the measles rash. It does fade away. The meningococcal disease rash, which is the one that gives you meningitis, does not fade away. So if you press the skin, if you blanch the skin, the rash is still present in the same colour, and that's often a purplish dark colour. That's different, and that's worrying. And if you see that on any child, it's a medical emergency. If the child's unwell, you should call 999. And if the child is stable, you probably can take them quickly to an A&E department. Yeah, that's crucial.
Yeah, that's fine. And I think acute rash is quite big. And essentially, like you mentioned before, it goes on the mother's gut feeling. So if you see a baby who develops a rash or develops a fever of some sort, they need to see some sort of medical attention to see what's going on. And then you mentioned about the meningococcal rash, which is the most important one. They need to obviously seek urgent medical attention, but even with other rashes, they do need to see medical attention at some point to make sure that nothing serious is going on.
Most of the time, if the child's very well in themselves and it's a blanching rash, it fades away when you press on it or roll a glass on it, fades away or it changes colour, it's not going to be worrying. Extremely common. Every child at some point in their life will have a rash. It's absolute certainty about that. So it really is nothing to worry about most of the time. So again, it's the same port of calls. So a health visitor, a GP, if you've got a newborn, then your community midwife, 111, which is a health advisory line. Failing that, hospital, obviously A&E. If you've got an unwell child, however, at any point during any of these concerns, A&E is your port of call.
Yeah, so essentially if they stop eating or drinking and they stop peeing or they're not weeing, that's the biggest sign.
Yeah, floppy baby is a worrying sign as well. So a baby should have good tone. They should be able to kick their arms and legs. Obviously when they're sleepy, drunk, they won't be as much, but they're still able to move all four limbs. A floppy baby is you hold them up, it's like a rag doll. Their arms flop by their side, their legs flop. So the baby's tone changes when it's a very sick child. So if it becomes quite floppy, that's something to be concerned about. If a baby's floppy, wake them up, shake them, flick their legs. They'll wake up, they'll start crying. Their arms and legs will start moving. It's absolutely fine. But if a baby remains floppy after a few minutes of you trying to stimulate them, then that's obviously worrying. A baby that's not feeding very well. So you're allowed to have up to half the normal feed.
Okay.
So if your baby's still wetting nappies, still pooing, maybe not as much, because they're a bit unwell, that's probably still okay. But you need to, if you're worried, you need to check it out. There's no question about it. So a baby that's not feeding, a baby that's become floppy, a baby with breathing problems, if they're making a loud grunting noise when they're breathing, or their chest is moving abnormally, or they're sucking in their chest when they're breathing, these are all kind of worrying things. And a mother can follow her intuition, a father can follow his intuition. So if you feel something's not quite right, go through those means we've talked about. If you're worried that you think, oh my God, there's something not quite right, A&E, hospital, 999. Don't hesitate. That's what we're here for.
Yeah, I think that's perfect advice for parents out there to make sure that they pick up on the signs. But like you mentioned, the biggest thing is if they can take up to half of the feed that they normally take, that's still a sign that the baby's still well. If obviously they become drowsy and not taking feeds at all, that's when they need to seek medical attention.
If you're at the point where a child's taking half their feed, they're probably fairly unwell. So I think they should have had a medical check by that point. So a GP check, a hospital doctor appointment, whatever. If that assurance that they're having half their feed, they're quite stable, should come from a medical professional. So if you're at that stage with your child, they should have a medical appointment by someone.
Yeah, and in our hospital systems, we do have good systems, routes through which children are brought into hospital quickly and are seen quickly by the doctors as well, compared to, say, for example, if an adult went into hospital. Is that correct?
Yeah, of course. So as soon as a child is brought to hospital, they're already taken to a different A&E department. You're not sitting in the main A&E department. So those things you worry about, the 4-hour wait and the people in the corridors, children are not in that category. You're triage, so you're separately seen by children's doctors usually. A&E doctors will decide if you need to be seen by a child specialist straight away or whether you're seen by an A&E doctor depending on what the problem is. And I think it's quite rare for a child to be in hospital for more than 4 hours not to be seen.
Yeah.
Pretty rare, I think, on the whole. So you're triaged straight away. So within the first 5 minutes of you presenting to hospital, the A&E senior nurse or a GP himself will decide how urgent the problem is. You're categorised according to traffic lights normally, so red, green or amber. Red meaning it's urgent, you need to be seen within 5 minutes, 10 minutes, 15 minutes. So you don't have to worry about that side of things. Depending on how urgent or how sick the child looks, they will be triaged appropriately and seen urgently. Certainly don't worry about that. That should not stop you from taking a child to hospital.
Okay. And going back to vaccinations, we were discussing this during the break as well. So essentially at the moment, Public Health England are thinking about ways in which they can essentially increase the uptake of vaccinations. And the Health Secretary, Matt Hancock, has said that he's willing to look at all options to boost England's vaccination levels. And one of them is compulsory vaccinations as well. How do you feel about this? And also, how do you feel about the fact that, in fact, of imposing vaccinations compulsory, how about educating parents about vaccinations?
Yeah, I certainly feel very, very strongly about vaccinations in children. But as with most things, and I think most doctors will feel slightly uneasy about making something compulsory or making it a law. So most of our training as doctors is all about patient autonomy, that a patient is overall responsible for their health and they should have the rights to make decisions about their health. Similarly, if a person had, I've given you a completely different example, but if you know a patient has cancer and they don't want to have chemotherapy, they have that choice. So as a doctor, you have to support them, educate them, but it's their choice. And even if it's burningly obvious that they've got a treatable infection or treatable disease, cancer, if the patient doesn't want it, you can't force it upon them. And that's all that our training is that. So the idea of having to force or make something compulsory, like immunisations, makes me feel a bit uneasy. I wouldn't say I'm 100% against it, but I don't feel very comfortable with it being completely compulsory for the reason that I think parents still should have autonomy and be able to make decisions. I do feel very, very strongly about educating families and children when they're able to make decisions, but certainly adults and parents. There is fountains and fountains of knowledge out there, which is a problem actually. There's too much information out there.
Knowledge sometimes, isn't it? Too much knowledge can be harmful at times.
Absolutely. So I think that itself is overwhelming, but I think my advice would be, if you've got worries, discuss them. Talk to your health visitor, your community midwife, your GP. If you're in hospital and you've had a baby and the paediatric doctor's going to do the baby check, that's the time. These are the people to ask about immunisations, your worries, discuss them. Ask them the bond or obvious things. Ask them, what's the risks of immunisations? Should I not? Have an open conversation with your healthcare professional that you feel comfortable with and discuss your concerns. That's probably the best way forward. If you don't feel confident to do that, or you're unhappy to do that online, obviously, but please use websites such as NHS UK. Don't go on funny websites, because that's the problem, because there's people that have, as with all things, taken a small bit of strand of information and blown it out of proportion and actually taken it out of context. And the important thing here to mention is the biggest, the most horrible study that was published in the last 15 years was the autism MMR study. And till this day, I hear again and again from parents, is there a link between autism and MMR? And categorically, no, there is absolute no association between autism and MMR. The study that published it was done at the Royal Free Hospital by a single paediatrician on about 12 children. And I think half of them, or 60% of them, already had an underlying neurological disease such as Down syndrome or cerebral palsy. So they were already in category which are higher risk of having autism. That was completely, the study was found to be dangerous, unfound. That doctor was struck off. That study has been taken out of medical literature. So it is the only study that if you look for medical literature, you cannot find it because it is taken out. And as far as I'm aware, it's the only study that's ever been taken out of literature because it was categorically proven to be the most dangerous and wrong study out there. But unfortunately, that small study has been exploited by dangerous people that don't have enough knowledge about medical health and have passed on that association till this day. It causes fear in people. But please talk to your healthcare professional because there is absolute no link between autism and immunisations, particularly no link between the MMR.
That's correct, and you mentioned correctly that parents who do need more information about specific vaccinations, they can talk to the health visitors, the nurses, and even doctors. When you go for your 4-week eight-week immunization, speak to the doctor, say what are the risks, what can I see, what symptoms will my child have, and it shows about the MMR study that you said that more than 500,000 children in the UK were unvaccinated against measles from 2010 to 2017. Which shows how much of an impact a study that's now been taken out of medical literature has had on the wider population. And just touching on what I mentioned about the symptoms that a baby can have post immunizations. I know we discussed this last year again, but I think it'll be good education for people listening out there. Yeah. So what symptoms do babies essentially have from a vaccine?
Yeah, so now your red book and your GP, the GP nurse practitioner that will do the injection will advise you to give paracetamol with the immunization, which is completely fine and normal. You should do that. My baby recently had a 2-month immunization, and my own experience, my baby was really unsettled for about 24 hours. So despite me giving paracetamol as per the advice, so I gave it before the appointment, but the advice is to give it just immediately after the immunization. So you give the first dose of paracetamol, and then you probably need to give it 4 to 6 hourly for another 2 or 3 doses. I did that. I bought Calpol. I gave it to my baby, but despite that, my baby had a low-grade temperature that night, was very unsettled, was clingy, didn't want me to put the baby down in the cot, in the bed. So I had to hold my baby the whole night. And he did sleep on and off, but he was just really unsettled and crying, and he felt hot to me. So these are all the normal symptoms that a baby can have. They can be unsettled, they can be crying, they can be clingy, they can slightly be reduced feed that night, they can feel hot to touch. So, and that can be despite giving Calpol. But if I hadn't given Calpol, I imagine the symptoms would have been worse.
Much worse.
So the important things to do are to be aware of those symptoms, and all of those are quite normal. They shouldn't last more than 48 hours is pushing it. I think if by 48 hours your child's still like that, they need to be checked out. They should be getting better after 24 hours. If they're not getting better, get it checked out. And Calpol, I think, or paracetamol, liquid paracetamol, is important to give to your baby. And I think they're the things to watch out for. There shouldn't really be any other signs. They can get a bit of red discoloration, a little bit of a lump around where the injection site was, but there shouldn't be any other problems with it.
Yeah, the legs are normally quite sore for the baby, so even when they're kicking around, even though they don't know much about it, it can get a bit painful for them, can't it?
Yeah, they can. So be a bit more delicate around nappy changes and that kind of thing. Yeah. If there's anything more untoward than that, then you just go to hospital and get it checked out.
And talking about vaccinations and that we're giving to a child, vitamin K is another one that's been coming up on the topic quite a lot, especially in Asian families. It comes up quite a lot, especially after birth. The nurses ask to want to give about vitamin K and stuff, and then a lot of our Asian parents don't know much about vitamin K. In fact, the general population do not know much about it. So do you mind explaining a little bit about the vitamin K injection?
Yeah, so vitamin K is offered to all newborn babies, and I would advocate it, and I gave it to my baby as well. It's to prevent, vitamin is, everybody knows, is a type of nutrient that your body needs. Particularly vitamin K is needed for blood clotting, and very, very rarely a baby can be born with a condition called hemorrhagic disease of the newborn. So that means it's a really horrendous disease, but a baby can essentially bleed to death. It's catastrophic bleeding, and when it happens, almost nothing can be done about it because it can't be stopped. But there's one thing that can prevent that from. It's probably going to. I don't know the exact statistics, but I think it's something like 1 in many hundreds of thousands of children will have it. So maybe 1 in 100,000 babies can be born with this condition. It's quite rare, but it's easily preventable by vitamin K. Vitamin K is an injection given to newborn babies, and it helps them clot their blood. And if you don't have that disease, it does nothing. It's just absorbed by the body and you'll wee it out. But in babies that don't have vitamin K, it's life-saving because it means that they'll be able to cause blood clots, so they won't bleed to death. So I'm a strong advocate of the vitamin K injection. I think it's one-off injection when a baby's born. If you're very much against a baby having it intramuscularly as injection, you can give it orally, but then you need subsequent drops of vitamin K as well. So that's an option that you should be aware of. I think the simple way is forward, one injection when the child's born. Often, as attending newborn deliveries, when a newborn baby's born and they're not breathing quite right and they need some stimulation, the best way to get a baby to cry is give them that injection.
Yeah.
So when I used to attend deliveries and the baby was a bit sleepy, floppy, not quite crying, I mean, can you give them vitamin K quick now? Give it, and the baby starts screaming and crying. Brilliant, you've got a healthy baby in front of you. Yeah. So that's not the reason to give it, but it was one of the reasons paediatricians liked giving it in the birth suite.
And I think with a lot of these vaccinations and especially vitamin K, in most cases babies are normal and don't have a problem.
Yeah.
But these vaccinations are there to prevent that rare case of it happening, because you don't want your child to be the one that's going to have that problem. Is that correct?
That's right, yeah. And there's a little bit of selfish, I don't know, but a little bit of selfish knowledge out there that people think there's something called herd immunity. So you don't have to vaccinate your child because every other child's vaccinated, the disease doesn't exist. Yeah. The problem is that in 10 parents, if 2 of you have that same explanation, then there's 2 children that can pass on disease to the 8 others around you, or vice versa. You know, so unfortunately there's not enough people with that belief to have the knowledge of herd immunity. I'm not an advocate of that at all. I don't think that's very safe, and I don't think it's stable, and I don't think it's true that you don't have to immunise your child because everybody else is immunised.
No, that's correct. And I had there was this anti-vax post on Twitter, and I replied to someone who mentioned that, I've got 4 kids, never vaccinated them, they've all been fine. And all the replies by medical professionals was that the only reason they're fine is because everyone else around them is vaccinated, and they're lucky. But there is a chance they can still get problems, can't
absolutely, because you're not the only parent with that belief. There's other parents out there, so you're the dangerous people that are children that can have the condition. Your child might get by with a mild form of illness, but it might be lethal to another child. So. Please, I don't advise that at all. Yeah,
if someone does have any concerns about why they want giving vaccinations to their children, please do ask a doctor or a medical professional as to whether it is contraindicated, because in a small percentage they are contraindicated. So that will be addressed accordingly. I know we've reached nearly end of the time, but have you got another few minutes, because we started a little bit late. One of the other things I wanted to quickly discuss is the growing amount of allergies in children. And I'm not sure if you heard about the story about the boy where the cheese was flicked at the little boy, and the little boy sadly passed away. Just want to touch a little bit about allergies and why allergies are increasing in children recently, and what happens with allergies with children as they grow up, essentially. Yeah, so it's a huge topic, and it'd be great if you almost need a different show to talk about allergies. I think you're right. Allergies are becoming more common. We don't know exactly why that is. It's something to do with your immune system. As we're becoming a society that's germ freak or whatever, your sterile society where everything we're using domestos for, and antibacterial wipes for, and these alcohol hand things for. I mean, they're very, very. I do believe in hygiene. I do believe in sterilisation. I think that's all very, very important. But actually, that's also one of the reasons why some people feel that actually some germs, some diseases and some allergies are becoming more evident, because our immune system is changing with us becoming more sterile. I don't think that's a reason to become unhygienic or dirty. I'm not promoting that by any means at all. I think it's very important to be very, very clean. But that's just one of the reasons why people feel that actually there's a change in our immune system. Yeah. That's also environmental changes, because obviously our lives are actually we're more in the home environment now. We're not so much in the outdoor environment. When in the olden days where people lived outdoors more, you're more exposed to allergens like dust mites, dog dander, cat dander, wheat, all those things, working in the fields. So life has become more home-based and more computer-based. So we're not exposed to allergens in the same way we were centuries ago. So that's also another reason why our immune system is changing. So these are some of the theories out there why allergies are becoming more predominant now. Allergies in newborns is a massive topic. Skin rashes are really important. We've spoken about eczema is actually really, really common in newborn babies.
I think people are quick to diagnose allergies, and actually quite quick to diagnose cow's milk allergy, which is quite a big thing out there.
Thing, isn't it?
Yeah, and you get all these lactose-free milks out there. You get these coconut milk formulas out there, hydrolyzed formulas. My advice is just to be very, very careful around these things. Make sure you've got medical advice around them. They're there for a reason. They are helpful.
Yep.
But I'm not an advocate of buying lactose-free milk out there, or buying goat's milk, produced milk instead of cow's milk. I mean, there's I think that the commercial industries have taken on this notion of allergies, and actually, as with all things, are making some financial gain. So I think you need medical advice, and make sure you've got that, and then and follow that appropriately.
Yeah. And with allergies, say a child is diagnosed, in a lot of cases, children do grow out of allergies, don't they?
Yes, they do. So your immune system is constantly changing, adapting and changing. If you're breastfed babies, this is one of the advocates I am of breast milk. So you pass on immunity to your child through breast milk, and that's something that you cannot give through formula, which is one of the biggest reasons why breast milk is the best. And you pass on immunity to your child, which can last for at least 3 months. And also, when a newborn baby is born, the baby's got immunity from the mother that lasts 3 months, because that's how long the immune system take to redevelop. So your baby's immune for 3 months from diseases that the mother's immune from.
Yep.
And also, if you're breastfeeding, you're passing on that immunity continuously whilst you're breastfeeding. So, so childhood allergies you can certainly grow out of. Eczema, things you can grow out of. Your immune system's constantly changing and adapting, but what you don't know is how long it's going to take to grow out of an allergy. You can't predict that.
Yeah, and I think in most cases, before parents do take any sort of step of stopping something, they should always check with medical professionals before they do anything, because that's the best way to make sure that what they're doing is the safest way of doing.
I think people, absolutely, and you please use your health visitors, because that's a really useful resource of information, and the local pharmacist is your local resource of information. So there's a big promotion right now, go to your pharmacist, and I can't really enforce that enough, because long GP waits, long hospital waits to see the doctor aren't always very useful. I think it's much more easier, it's more resourceful to go to somebody who's local and is a fountain of knowledge around your health visitor, your pharmacist. Things like allergies, things like skin rashes, things like minor conditions that your child isn't particularly unwell with, you need some advice, go to these people, because they're readily available. Normally they'll be standing there waiting for someone to give advice to you. And
that's pretty true, because there is a recent scheme where now pharmacists are now being trained to essentially start prescribing on common and minor ailments, including antibiotics and stuff. So pharmacists, I think, are undervalued in society.
I agree.
When actually they have an immense knowledge. In fact, us doctors, and even as a medical student, if I need some drug information, the first person I go to instead of my consultant would be a pharmacist.
Absolutely.
In fact, consultants such as yourself, I'm sure, consult with pharmacists in order to make sure that you're prescribing
on a daily basis. So as part of our team in pediatric rheumatology at the Evelina, we have a pharmacist in our team who's absolutely wonderful. We prescribe very very expensive drugs. We go through the pharmacist. We work together as a team. We work hands together. We're very, very close with pharmacists. And you're absolutely right. The more junior you are as a doctor, on a daily basis, you speak to your pharmacist for advice. So yeah, absolutely, the public should be aware of that and be able to access their pharmacist. Yeah.
I think we've overdone our time, but that's the end of our show for today. I just want to say thank you to Dr. Nadia for being here today. Hopefully I can try and get you for another week or so as well, because it's really useful, especially for the public, because pediatrics is one sort of field in which education, especially in the Asian background, is very, very limited. In fact, in the general population, the more education we can give, hopefully someone can benefit from this education and we can make the most out of it. Just a quick, someone just mentioned what surgery you're from, but Dr. Nadia Rafiq is a consultant rheumatologist at the Evelina, which is a specialist sort of field down at St. Thomas's, essentially, isn't it?
Yes, that's right.
So for next week, I've got another pediatric trainee from the Royal Free, I think it is, Dr. Yasin Fatin, who's going to be with us between 1 and 2. So as always, you can drop me a message beforehand on the live stream that's there, or you can drop us a message or call us again on the number if you have any sort of questions. And what we're going to be talking about is about the training process that goes in pediatrics, how Dr. Fatin got to where he is at the moment in his training stage, his journey to medical school. And essentially the other topic I want to discuss, if there is an audience out there for it, is for sixth form students, anyone who's applying to not only medicine, even university. I'm more than happy to give any sort of advice when it comes to personal statements or even career choices. So if anyone does have any questions like that, please call in next week or drop us a message and we'll be able to help. But for now, thank you to Revive FM for giving us the opportunity. Thank you to Dr. Nadia Rafiq for being here today. She's taken out some very precious time to be with us today, so Jazakallah khair for that. And I hope Ramadan is treating all of you well, and inshallah we'll see you all next Saturday between 1 and 2. Assalamu alaikum wa rahmatullahi wa barakatuh.
Always be there, is always watching us.